This morning we are looking at how communities have got round the pastoral care, and it'd be interesting to hear how pastoral care has been happening in the community. We have 3 panelists today. Hopefully they're all going to speak for about 7 or 8 minutes. I do have the power to mute if you carry on. But we've not needed to use that. So we've got Reverend Sakaya from North London? South London, sorry, from South London. Mandeep has been on these before. Mandeep's going to be speaking. And Sophia from East London Mosque, is that correct?
That's right, yeah.
That's just down the road from where we're based. We're based out at sort of Dagenham. So we're not too far from you. So what we've asked is each of the panelists just to give us a sort of a brief update on how they've been managing to sort of show pastoral support to their members. And then we'll obviously at the end we'll open it up for some questions and we'll see where we go. So if I could ask everybody to mute themselves except for the person who's speaking at this point. That will just make it easier if people's phones go off or there's other interruptions, so that'd be great. And I think if we can start with Reverend Sakaya, that'd be brilliant. When you've unmuted, that's it, brilliant. So just tell us a little bit about who you are and how you've been doing your pastoral support in these over the last 6 months or so.
Yes. Good morning, everyone. It's good to see you all. So my name is Reverend Sekai. I'm here at Church of the Living God Ministries. We are in London, Southeast London, Forest Hill. For those that are familiar with London, we're in Forest Hill. And so we are quite, we can say a small church. You know, we're talking about less than 20 people. And so we realized as well that when everything started with the lockdown and we were not able to meet, one of the things that we had to do was to adapt ourselves. And I think that's the word for the church as well, that we have to adapt, because I think we get set in our ways, we get set in our systems, and then when these things hit us, sometimes we just don't know what to do. So that was us right there. We just didn't know what to do. And then, we just realized that church goes on. And we just realized at that point that as well, church is not the building as well, because we were so connected to the building. And when the building is shut, it's like, what do we do from here? Where do we go? The church is destroyed, literally. But the church was alive because we are the church. We are the church. We, the people, are the church of Christ. And so when we realize that we are the church, we begin to, one of the things I did as a leader, was to communicate with the church as well, to let them know that we are going online. So we discussed about being online, but I didn't just want to go online and then I go back to the system of me, us leaders teaching the children. And because I realized that although the church was online as a new thing, the world was always online. The world has been online. That's why the world is very known and popular, because the world had the capacity to reach out millions of people, in a moment. And we as a church, we had our system that we would meet in a building and we would do church. So I said, I need to take advantage of this situation. If I am going to be online, I will not go online as if I'm still in a church building, because sometimes when people meet online, they also meet with the same members, if you know what I mean. So you connect on Zoom, you've got your same members with the link, and that is it. For me, I wanted a bit more than that. So what we did is, although we had the link, although we were meeting online, I would put it out there on Facebook Live, on sometimes YouTube Live. And so we were connecting in the moment, whether it's Bible study, whether it's a Sunday worship service. We were connecting with thousands of people that we would normally not meet, and that was amazing. And also our church, although we were small, like I said, we will be regarded as small, comparing to other churches, what we realized is that we were no longer small in the sense of the numbers, because right there online live, our church members were corresponding, they were communicating and with other people from all over, all over the world, literally. And when we finished the service, what I began to do was to sponsor the teaching, where maybe it was the word or Bible teaching or worship. Sometimes we did worship on live. And we sponsored it. And I'm telling you, it's not even expensive. I was having a budget of just £10. I would sponsor for £10 for 5 days. And we have viewers between 10, 15, even up to 20,000 viewers. So for me, that was a big success for the church, because now on a Sunday service like that, after sponsoring it, we sponsor to the areas that we want. So we were targeting areas that we know normally they don't have the freedom for the gospel. We're targeting places in Asia. We were targeting, Africa. We were targeting here as well. We were targeting different places, because you can choose the countries you want the message to go. Sponsoring. So it's almost like we had more power, let me say, to reach more people. And that's the good side of everything, because I think sometimes as a church, we see the negative side of the restrictions. But for me, I am discovering a new world of opportunities, a new world of ministries, a new world where you can reach many, many people that would normally not come into your church for anything, but because you're online, you can meet them in different nations. So for me, this is what we are now. We are a church without a wall. We are reaching people, and because when the church went back to building, we had an issue about families. We are a church whereby everybody almost has a family, like children, and we knew that restricting children was going to be so impossible. And sometimes telling your children, don't do this, don't hug this one, it was all just, being a bit, we didn't think that we are that kind of a church. So we continued online because we saw the fruitfulness of it and we were benefiting from it. And also the church members have stepped up as well to have avenues of themselves whereby they're sharing the word. So literally disciples are being raised in this season. That's all I can say for now. Thank you.
Thank you, Sakara. We might have some questions for you later, but we'll allow some time now for the other panelists to have a chat. So I'm going to hand over now to Mandy. Can you just let us know how you've been exercising sort of pastoral care in the community at this point?
Thank you, Martin. I'm Mandy. I work for an organisation called Gurdwara Aid, and we've been working with Gurdwaras up and down the country since the Places of Worship Task Force was announced in early May and the lockdown. What we have seen is that in the early days of the lockdown, about half of the Gurdwaras went online and started streaming their services because a lot of the congregation were losing touch, and they wanted a sense of where they could continue to worship. So that was one of the earlier things that we saw that started happening. Since then, what we have found is that many other online groups have sprung up, mainly from congregation-led initiatives, and they've set up their own sort of groups of their own congregations, and they have their own Zoom calls on a regular basis, some daily, some weekly, in order to continue this contact and worship and discussion and sort of the community aspect of it. The other side that we've seen a rise in activity is in increasing chaplaincy type services. In the early days, where members of the community were in hospital, they couldn't be visited. Nowadays, there is an increasing chance that you can visit them. So chaplaincy type services have come more to the fore, where they can offer this additional support for people who are in hospitals or in prisons or other places like that. The other side we've seen an increase in is mental health type seminars and sort of activity within the community, and a lot more calls and meetings and webinars which are going on around this to get this to the forefront. I suppose the last thing we've seen is also an increase in activities in service to the community. So about half of the Gurdwaras also have repurposed their kitchens to produce langar, which distributes to the community. So we've seen an increase in the number of volunteers coming forward to help with this, and that also helps keep in touch with the community in some shape or form. So those really the sort of areas that we've seen things which are happening in the Sikh community.
Yeah, great. Mandeep, thank you for that. And again, we might have some more questions for you in a moment. And then last but not least, Sophia from East London Mosque. Maybe you can, if you unmute yourself, you can also tell us a little bit about how you've accommodated some pastoral care.
Good morning, everyone.
Morning.
So I'm Sophia Alam. I am the Mariam Centre manager. So Mariam Centre is the women's wing, if you like, of the East London Mosque. On the senior management team, and we were very proactive in just before the lockdown, hearing the numbers going up, liaising with the council. We, like Reverend said, we had to introduce this change that was going to be happening, which was is very significant for our community. Of course, congregational prayers are really important, and it's a fundamental part of the Islamic faith, and we pray 5 times a day, and it's recommended to pray during 5 times a day in the mosque. So you can imagine, you know, the reaction of elders who have been praying every single day, 365 days in a year, for 50 years plus.
Yeah.
To say that you can't come into the mosque. And you know, we had to even adapt our call for prayer. So the call for prayer is inviting people to come to pray, and we had to change that, and that's, you know, it's recommended in times where there's difficulties that pray at home. And this whole education was you know, it was a shift to the mindset, to the normality that people knew. And our imams were very instrumental in delivering that. We fortunately had live streaming from before on our Facebook pages. We have what is called Mixlr, which is a stream that's from our website. It's a very well visited website. And just to give you a size of the congregation, we see over 7,000 congregants every day. And in the month of Ramadan, that goes up to 10,000. So you could imagine the footfall we have every day.
Yeah.
And to reach to an audience that size, technology made it easy, but we have to also remember there was a lot of digital poverty in the borough, and people not used to having gadgets and technology, and quite swiftly they've been introduced to that, including some of the mosques that we work with. So we work with the smaller mosques as well, and there was a lot of resistance in people closing the mosque, and we had to work together with the Interfaith Forum to say, let's do this together. This is, you know, this is for the better good of our community. And it was a very emotional roller coaster, if you like, because we were bang in middle of Ramadan. Ramadan is obviously the fasting month, and obviously people are shielding, they've not had access to the spiritual congregational prayer, the night prayers that would have usually happened. But the imams had really nicely articulated and trained and gave lots of circles online and lectures in terms of how you can make your home a prayer space, how you can lead your family in prayer. And actually a lot of people really appreciated that. They actually felt this connection with their families. They had more spirituality. Of course, they miss their friends and neighbours, and you know, part of congregation is to meet people, and So people who were living alone it was very difficult. So our volunteers actually provided a befriending scheme where people didn't have access to technology were able to visit them, see how they are, from the doorstep. But our lines were open. All our receptions, the Mariam Centre receptions that cater for women and vulnerable women who require help, our reception lines were open. They were on remote, so we were able to help people. We very quickly opened a food bank call center. We worked with an existing food bank, and then we quickly realized there wasn't cultural food that is required during Ramadan, so we catered for that. We opened our own food bank, and as a result, people engaged with us via phone. We were able to kind of help them deliver medicine and food, and more so what we've seen, this adaptation that Reverend had mentioned, is that the community are actually loving Zoom. We have over 35 circles that happen. Circles are circles of knowledge, so they're either Arabic classes or activity classes or just learning the Quran. And they're in different languages, so we cater for the Somali community, the Arab community, and of course the Bangladeshi community predominantly. So we have different classes in different languages, and they were all delivered, and they are still being delivered on Zoom. And not only are they being delivered, normally we would have up to 20 people in a circle. It's gone worldwide, so people are joining from their home countries up and down the country, and they're really appreciating it. One of the things we then realized that this is quite a powerful medium to reach a high number of people, and we could give the messages that we want from public health and the spiritual messages that people will still feel connected to the mosque, and do some fun activities. So we had 2 Eid celebrations, which, Eid obviously is about family and friends and community, and it starts off with the prayer in the morning. So we were able to do some services that the whole community felt that they were still engaged, but within their own little hubs. So we adapted, and we're still adapting, and I think it's a very difficult time now to see numbers. One of the other things I want to say is our community was the most affected by COVID. We saw a high number of deaths. And as a result, the mosque responded, and the community responded in supporting us to build a mortuary to dignify the death of those who, their body lied in their homes whilst the funeral services were overwhelmed. And this we did before even the Nightingale hospitals had been built. And that was just the community coming together, wanting the mosque to lead in terms of dignifying their deceased. And it's a place that we don't want to go to again. And with the numbers going up, we're really honing in on the message and the spiritual responsibility, what our faith says, in terms of preservation of life and looking after self, and really working with the local authorities and maintaining your spirituality within your home, and there's so much more you could do. We have hundreds of volunteers, and they've just been instrumental in supporting, in befriending, and really looking out for everyone in the community.
Great, Sophia.
So I'll stop here.
It sounds like you've been doing an awful lot. It's an amazing amount of
really busy mosque.
stuff that you've been doing. It's very good. Thank you for that, and thank you to the other panelists as well for what you've said this morning. I want to open it up now. You can, if you want to unmute yourself, if you want to talk. Maybe some of you can share some of your own experiences then of sort of demonstrating pastoral care in your community. What sort of things have you been up to that would demonstrate that?
It's Shirley here.
Hi, Shirley.
Hi. We've we've had to spend a lot of time supporting people through different kind of mental health issues, because people have found it really quite distressing. So a lot of our pastoral care has been putting on, for example, Zoom forums whereby people who have skills in mental health, people who are mental health practitioners, who can support people, walk with them through the traumas that they've experienced, because we've experienced people who've had COVID, people who have sadly passed away, friends, close friends. So we've had to create a number of forums online via Zoom, whereby, particularly this was in the heart of the lockdown, whereby people could, you know, walk through their difficulties and so on. So, and as well as that, to just be there generally to give counselling, you know, one-to-one counselling over the telephone mostly, because as I said, this was in the heart of lockdown. Where, so it wasn't even appropriate even to go to their front doors at that point, because we just weren't allowed to. So we spent a lot of time making sure that we reached everyone, making sure that we reached the vulnerable, the elderly, people with underlying conditions who were particularly anxious about the potential of catching COVID, trying to ensure that people had information so that they didn't feel that, you know, knowledge is power. So the more information that people had, they could then govern themselves accordingly. So that I must admit, we spent a lot of time doing that, as well as building faith through our services, through you know, teachings and so on, to ensure that people felt that they had enough undergirding, so to speak. Can't think of a better word.
Yeah, no, we know what you mean,
to
Shirley.
walk through, in order to go through the trauma and also go through the massive change, because people, it was kind of like 1 minute things was going on as normal, and then the next minute everything that we knew to be normal what had kind of been wiped away. And so quite a few people, both young and old, as well as, you know, people with existing health conditions, as well as people who were, you know, normally healthy, had to walk that journey. And you know, we spent a lot of time walking that journey with them.
Thank you, Shirley.
And still do, in fact.
Yes, thank you. That's great. Who else would like to share? Sheila.
Can you hear me all right? I've unmuted myself. Yes, things are very different where I live, because I live in a village. But I would like to say that a lot has been done to include people in church services. And I've been very interested. It's been the older people who have embraced an iPad just for getting the church services. And I think that's wonderful. So it's led me to take a look at running workshops to help older people choose what they'd like to do with an iPad and then stick with it. And I don't know whether anybody knows any areas where you can find funding to buy older people iPads. We've got one near Bradford, and that group has got some money and bought a lot of older people iPads and enabled them to go on. And we've used the skills of the people in the congregation or the church membership to help people get online and access the services. So I think it's worth noting that it can be done.
It can.
I'm very interested in how it's being done through Sophia.
Thank you. Yeah. Sophia, just before you do that, I'm part of a local church here, and every Sunday morning I go down the road to help an 80-year-old get online before the service. So she gets there, she sits there with her headphones on and she participates. So that's one of the things that I do every week, is to make sure that she's online. So Sophia,
lovely,
you were going to...
Yes.
I was just going to say to Sheila that I know Age UK had some funding. I don't know if you have a local Age UK, but if you go onto their website, they've been supporting people with technology as well. But it's really important to tap into your local charity and see, you know, what they can do, and that is your need, because there is a lot of funding out there for
There is,
digital
yes.
inclusion. So if you don't ask, you don't get.
That's
Yeah.
right. Thank you very
Good
much
luck
for
with
that.
Thanks,
I've just
Sophia, for
received
that.
an email from Age UK with a small grant scheme.
Yeah.
So I think I'll apply for it for
That's
iPads.
good, yeah.
Lovely.
Even if you
Great.
get 3, it's 3 who wouldn't have done it if you hadn't done that
Absolutely.
for
That's
them.
it.
Absolutely.
Yeah.
Yeah.
Yeah, great.
Thank you.
Thank you, Sheila, as well. Thanks, Sophia. Who else
Sheila,
would like to share?
just another suggestion, Sheila.
Yes.
Your local CVS from your council may also have funding available for community, so that they're also worth approaching and to see what's available.
Yeah,
Thank
brilliant.
you very
Thanks,
much.
Mandeep. Yeah, it's great. Who else has got something to tell us? Yes, Christina.
So during lockdown, I'm the church centre manager in somewhere called Chester in the northwest. You might know of it.
We've heard of it.
So I'm the church centre manager, and obviously when lockdown came, the whole building closed down, and I was given the task of looking it out towards the community. So we printed off leaflets to go through all of our parish doors, basically saying that there was help in Hull if people were stuck, if they didn't have families, if they didn't have people to go shopping, pick up prescriptions, take the dog for a walk, whatever it was. And we, within a week, I think we leaflet dropped about 4,500 houses. We didn't get a stampede of people needing help. We did get an almost stampede of volunteers saying that they were willing to jump on board and help us. Yeah. So we ended up with about a 50-50 split with local people and church family members. And we got linked up with our local council, a food bank, and just sort of worked together. The NHS, local NHS would contact us to say, could somebody go and get a prescription? More often than not out of our area, but we had volunteers, so we were able to just pick up what we did. I think we did about 90 tasks in general over a period of time. So it was just, for me, mainly managing the volunteers and making sure I hooked people up to people that live near them as well, because I really felt it was a really positive way of getting neighbourhood, people living near the same streets to help somebody near them, so that it kind of helped build up a bit more of a community feel, and so that people would be looking out for their neighbours. And we've still got a couple of people that we're still helping now, one of which is a 95-year-old man who can't get out the house, so we shop for him every week still, get a newspaper daily, pick up his prescriptions and things like that. So although we're not in a really poor area, there was sort of more older people that just wanted somebody to chat to on the phone. And we also ended up with family members who lived further away contacting us to see if we could help their family that lived in our parish. So that was really positive.
Christine, it sounds like you've been quite busy.
A little bit. I'm now back into centre manager mode as much as anything now, but
that sounds really good. Really good.
It's been interesting.
Daniel's waving at us.
Yeah, I just want to pick up on what Christina said there, because I think what's interesting, we've kind of got this from different angles, is that we're all a lot more happier if we can be the one who's offering help. But actually, we suspect that some people are offering help. Of course, everyone has got something to contribute, even if there's a sense of I'm someone just to be served, that still actually provides in the need of people to serve. So I think that's an interesting kind of thing to that. I had a visit a number of years ago to a Jewish care centre in Redbridge, and I was challenged by the volunteer coordinator, a lovely lady, sadly passed away now. She said, "Can you spot the volunteer? Can you spot the recipient in that sense?" And you couldn't, because I busying, involving and being involved in that kind of thing. And certainly, Martin, you recall some of the stuff that we were looking at locally. There was far more people offering to do befriending calls than there were people who were actually saying they want to be befriending. So I think sometimes the case is to get those befrienders to practice on each other, because I think it just gives us the excuse we need. The NHS folk have told me that if you are one of their volunteers and you go to deliver a food package or go to buy food for someone, that will take about half an hour, but collecting the list will take a further half an hour, and delivering it will take half an hour, because actually people will happily ask that they need help or need some kind of practical, but actually what they're really desperate for is connection. And I think I suppose it's upon us all to make sure we take all of those opportunities to because people don't like kind of saying I'm lonely. I don't think any of us like saying that, but I think it's an interesting thing. I was interested, I think I had to rush off and make myself coffee, it being the coffee house. So I think I don't know if it was Shirley or someone was talking about mental health and visiting people on doorsteps. I'm not able to do that. And I was interested in if there was a sense of restriction, because I've been surprised at how infrequently people have taken the opportunity to just go on, even in lockdown, on your walk. I used to go and knock on a couple of houses. I didn't go into their houses, but I just shouted them down the path or what have you. But I certainly even within my community, people were very limited in doing that, and there was no prohibition about that. And I wondered if there was what people felt about that. In parts of the country, some of you may be more locked down. So we're in London and we're resisting lockdown at the moment. But Penny, you're up in Preston way, aren't you? So you guys are well locked down. So I'm just wondering if you've done any postman visiting at all. Oh, you're muted there.
Yeah, I mean, Preston Baha'i community is a small, a relatively small community in Preston. But over the years, we're very involved. We've networked with I'm on Preston Faith Forum. We've networked with sort of the Resilience Forum, etc. So, the Baha'is are represented in sort of, many of the things. And our local council has been absolutely fantastic. We have a faith covenant. We're a city of sanctuary. So, we as Baha'is, we very, and we have links to sort of UCLAN. I think what we've been doing really is sort of using certainly the Faith Forum, using it in a sense of signposting, language linkers. There's so many things I've never heard of, but there are so many things available. And obviously, we being a city of sanctuary, we've been sort of supporting sort of refugees under Preston Faith Forum. We have Hello Preston, which is a project sort of helping refugees. Lockdown's sort of obviously difficult, and there's no argument that, people have sort of, even friends of mine who I think are pretty resilient, even myself. I mean, I'm isolating because of self-isolating at the moment as well, because of meant to go into hospital on Monday. But I've been told that it's been deferred now to the 30th. So I've already isolated for 8 days. So now on Friday, just for a small operation, you've got to isolate 2 weeks before. And so, even for somebody who's having something done, even though you might be looking forward to it, there's still an awful lot of, self-isolation going on as well, on top of the fact that we're already, we're tier 2. I think we're resisting sort of tier 3 at the moment. But there's just, there's so much that you can do. I mean, as Sika was saying at the beginning, that the church doesn't have walls. I mean, the Baha'i faith, we don't have buildings anyway. So in that sense, we haven't had to close anything down. We've just had to sort of, be creative. I mean, one of the things we've done, I was talking to my friends and we were all saying sort of, we're so used to sharing food. I think food is a big part of faith, and we're so used to sharing food, and we've been unable to do that, So we decided sort of, blow this, let's just share recipes. So, right. So we'll each share a recipe so that, instead of me thinking tonight, what am I going to cook? It's like, oh, great. Sophia sent me her recipe, or Safina sent me her recipe. We have the Voice of Women and Sisters for Sisters in one being mainly Christian, the other being mainly sort of Muslim. but then of course sort of, you know, we've inveigled our way in. So there's a Baha'i, a Sikh, a Jewess, etc. You know, so so we decided that blow this, let's all just share recipes. So we've, you know, it's lovely. I mean, I made an apple sponge the other night, and I wouldn't have made that for pudding if, you know, Marion hadn't sent me. So
Penny, that feels like a business opportunity now. So my ears are pricking. I'm thinking, I wonder if we could get behind and co-badge a kind of faithful feasts or something like that. Kind of, you know, recipes.
I was just thinking, I need to be on your email list, Penny. That's all I need.
But it was just something so simple, you know.
And it was it you who delivered a cake somewhere? Someone I was on a call with, and they just kind of randomly delivered cakes.
Yes, yeah.
I'm still waiting.
I did some baking and just stuck a cake on people's doorsteps and things, you know. I mean, I've posted like through people's doors. I've just posted just a little bookmark, you know, with just a sort of, you know, Happy Monday kind of thing or whatever. You know, it's really just little things. And then I went on Nextdoor. We have, I don't know if you heard of Nextdoor, like neighborhood type of thing. I don't know if you have that. It's called Nextdoor, and it's basically bringing sort of the actual local community together. You know, you can either sell things that you don't want, or you can, you know, say I'm a joiner and does anyone need any help, or that kind of thing. And I went on there and I just said sort of, you know, I've got experience in counselling and mediation and whatever, and should anybody, you know, anybody just want to have a chat. And 3 people got in touch with me, which was really nice. One lady I'm still in contact with now, and, you know, she rings me every 10 days or something like that. And she just says, Penny, I'm desperate, you know, and I fair enough. And we'll have a chat. One lady rang and she just literally wanted to have a COVID attack, I think. I think she just wanted somebody to, you know, was more or less holding the phone a good foot away from here while she had a sort of, you know, a COVID moment. But sometimes people just do need to ventilate, so that's okay as well.
I've had a question come through on the chat privately, just to say our postman visit's okay at the moment in tier 2. This is the way I interpret it. In lockdown, when we were in total lockdown, I would take a walk. And I would, you know, I would go past someone's house and I'd knock on their house and I'd speak in that. You know, I've not been arrested yet. We're recording this one today, so it could happen. Yeah. So I think it can be all done in a safe way. I'm not going in their house and not crossing their threshold. You know, I probably even use my elbow to press their doorbell. I think that postman visits are all right, but the key thing is you stand outside. You know, they're standing inside your house, and it will be an issue in terms of the cold. But as any of you who've worked in early years will know, there's no bad weather, just bad clothing. Oh, there you go. So that's look at the sage nodding going on around. Yes. So I think there's opportunity to do that kind of stuff, and I think actually we could do with having a bit more opportunity to go around and connect with people. I'm surprised if you've ever been on the tube in London and something goes wrong. People are desperate to talk to each other. I mean, you stand in the most intimate positions with people you'll never meet again, and you don't talk to them. But the moment the tube stops, people are looking for that. So the clap, the NHS clap happened with that and that kind of thing. I mean, the other fantastic thing about the tube is no matter how packed it is, people always give you room to fall over. If you start falling, everyone will nicely get out of the way so you can fall over. It's a very English thing in that sense. But I think there's a lot more opportunity to talk. I would like, with the approach of Christmas, I'd like to try and see if we can do more carol singing, but I don't know if there's any Hindus with us who could give us any thoughts about whether there's any particular Diwali celebrations we could have. Just keep the fireworks away from my wooden hut. That's the main thing I'm worried about. People having fireworks in their garden. That's my thing. Go on, Martin.
I think the thing I was going to pick up with that even came out we were talking to some, I think I was talking to some Buddhists yesterday, that Zoom and digital is fine, but actually face-to-face, real-life connection is always the best. So door knocking and standing in the front drive or whatever it is, if you can find a way to do that, then that actually is really good as well. So just a last opportunity, if anyone else wants to share anything of sort of good practice on pastoral care. Reverend Sakai's got a hand up. Kathy's got a hand up. Warren's got his hand up. Oh, look, we've got a big rush now. Right, let's keep it short, a couple of minutes each. Sakai, do you want to just...
Yes. No, I just wanted to add that one of the things we should look into as a church as well, or if you're in the Muslim faith, is that we tend to, in times of crisis, we tend to look after our own. Our own church members, the welfare of our own church members, what's happening with our church members. Are they depressed? Are they lonely? Do they have a need? We're talking about our immediate, but then, as we need to realize the opportunities that are being presented with this coronavirus. We need to go beyond. We have started what we call listening ear, because we have identified the depression and the mental health challenges in the whole community at large. And like Daniel said, we sometimes it's hard, impossible to visit as many people as you'd want to. So we have this telephone calling. We've got the dates and the times available, where it doesn't matter your religion. It doesn't matter, where you're coming from. If you just want somebody to talk to, if you want somebody to, we just called a listening ear project, really. So basically, anybody can call in. And if you want prayer, we offer prayer. If you just want to be listened to. And so these are all things available for us, because the community has a need.
Thank you, Sakaya. I'm just going to move on quickly. Kathy?
I just wanted to agree with Daniel about the volunteers, because one of the things we found is where our church was part of setting up what's now becoming an ongoing charity called Burns Would Be a Friend. And we were inundated with volunteers, because people want to feel that they're offering something of value. Yeah. And I think it really does impact on them as much. But we've found there are so many needs in the community. One of the big ones that we've found is for furniture. People desperately need a cooker or a new bed, and we've been able to help in those situations. So there are lots of different ways, as well as the food deliveries, the prescriptions. There are lots of ways people can help. And from my church, I've been part of a pastoral team, and we've done the phone calls to... Initially, during lockdown, everybody had a phone call every week. We've now limited that to people who are more vulnerable and still not getting out. So they're still getting regular phone calls. But, trying to find volunteers isn't hard, because so many people want to be of use.
Yeah, thank you, Kathy. Warren?
Some of what I was going to say has been said, but in both communities I'm involved with, we made sure that there were regular phone calls round, often followed up with deliveries of food or medication or whatever else people needed, and we arranged for shopping to be done. And I think what Daniel was saying about the human touch, when people actually do the deliveries of the stuff and can then stand socially distanced once they've dropped it off at the door, and then have a brief conversation with people as well. All that's important. And all of my pastoral work's really been done on the phone as opposed to in person. But I work with the community in Liverpool as well, and I think we're going to have to step up the concern and care at the moment as well. We've got a meeting tonight to hopefully put everything in place to reintroduce the regular stuff, and just various elements of care and concern around. I think what Sakai was saying about the sort of looking wider as well. Thankfully, we have in both of my communities members who are involved with some of the local initiatives and looking to support homeless and refugees as well as sort of stuff with our neighbours. The Thursday night clap, I think, was a crucial time just to see neighbours, and now I think people are just knocking on and seeing how people are if necessary. So we're going to have to keep that going, I think, for months yet. It's good to see the way people have rallied around.
Yeah, thank you, Warren. Right, Penny, and then Syed. I can see your hand up. Penny, you raised a hand earlier.
Literally just a couple of things. One is take away for a walk. I mean, you know, my friend takes a walk down my road and she just literally waves to me. I'm usually, you know, where she goes past, and it's kind of caught on. And so taking a wave for a walk, sometimes just looking out your window and somebody waving at you, you know, doesn't matter if it's a stranger, you wave back. And the other thing that is lovely, we have a walk called Bluebell Walk, and there's a fence as you go in, and people have put lots of little things on the fence, whether it's a ribbon, whether it's a sort of, you know, somebody's put a little toy car, there's little quotes, there's all sorts of things that people have just gone on a walk and they've literally just tied it to this fence. And it's just lovely. It's just so nice to, you know, to walk into Bluebell Wood and just see, you know, this little fence with so many lovely things on it, rainbows, etc.
I think that's a whole nother subject about getting out into nature that I quite enjoy doing, but we can do with that. That could be another coffee house subject, Jenny, going you know, in a few weeks' time. Saeed, hi there.
Yes, hi, thank you. I am from West Yorkshire, a place called Kirklees. So it covers Batley, Dewsbury, Huddersfield, etc. So I work in the NHS, but I'm also working with the voluntary community and faith sector as well within my area. So I spend a lot of time working as a volunteer for some community projects. So recently, what we've done is within Kirklees, we've got a lot of allies and a lot of partners. So we looked at the issue around COVID and around people in our communities and vulnerability. So we've been working with various NGOs like Umma Welfare Trust, who've delivered PPE to Bradford Royal Infirmary a while ago. One Nation, who've delivered some food parcels to Mid Yorkshire NHS Trust, and also Sootle Mosque, who have delivered 500 food parcels to Leeds Teaching Hospitals Trust. Also in Dewsbury, the places of worship, the Muslim places of worship and the Christian places of worship have delivered up-tea meals to people who are most vulnerable. So they have actually become a health and social care provider, which is absolutely magnificent. The other thing as well is that there is a northern arm of the Council of Mosques that have recently been set up to look at all aspects of obviously reopening the mosques. And obviously Matt Hancock played a part recently in terms of a few hours before Eid. You know, there was a lockdown within a defined area where there was 5 million people, so that made life really difficult. But I must say that the Muslim community over the Ramadan period, you know, going on to this period, have been very resilient in terms of following the rules and regulations of the government and of local lockdown. You know, secondly, we've realised and recognised the disproportionate impact of COVID on BME communities, in particular the Pakistani and Bangladeshi communities, who are 3 times more likely to die from COVID than people of white ethnicity. So what we've done in Kirklees with the partners is we've actually got a live survey going out. So far we've got over 100 people who have actually responded to the Kirklees Inequalities in Health survey. So the survey asks particular questions. Now, not everybody can access the survey, so we've also held some listening events over webinars, and we've listened to people. So for example, a couple of people have actually phoned me and said whilst the places of worship have been closed, they've had some mental health difficulties, especially a lady that's got as part of a recovery plan going into the local church. And while she can't go into a local church, part of a recovery plan has been really, really difficult. And similar things have been said from a Muslim perspective. So I think we're all feeling the impact of local places of worship being locked down and then being reopened. And then also in terms of what colleagues were saying around the severe emotional and psychological impact of COVID on individuals. So the pandemic is really, really taking its toll on people's, not just physical health, mental health as well.
Saeed, I'm gonna stop here. Thank you for your contribution there. a lot of the things you said there echoes some of the things that Sophia had reported as well about how the mosque had adapted to look out for the people in their community. It's been a very good session this morning. Thank you everybody for coming along. Jenny, as always, what's next week's subject? Because I can't remember.
So next week, another best practice session, and it's about the provision of childcare during services. Okay.
Yeah, that was interesting actually, because childcare and young people, and we're going to look at the impact and best practice on that. Now, I am presuming that all of you are Faith Action members, which basically means you receive emails from us each week. Just a little heads up, Kathy knows what's coming, but we've got an exciting development coming. In the next little while, there's going to be some emails dropping into your inbox. Look out for them. A few little changes ahead, but hopefully all for the best. But like I said, we've already talked to Kathy, so she knows what's coming. But anyway, appreciate your time, everybody, especially our three panelists today, Sophia, Mandeep, and Reverend Sakaya. Thank you so much for your time. Everyone else, thanks again for joining us. And same time next week, with a cup of tea in hand.